Hello, everyone. Thank you for joining us today. We're just going to take a quick minute just to wait for everybody to join, and then we'll get started. Okay, we're gonna get started. So for those of you who don't know, my name is Mia Spencer. I use she, her pronouns, and I'm a rising third year here, and I've been working with the orientation program the last 2 years. This year, I'm working as a student coordinator to help coordinate events throughout the summer with the onboarding and the orientation initiatives. This being said, you'll probably see me a little bit throughout the summer and into the fall. I'm now gonna hand it over to Caroline to introduce herself.
Hi, everyone. My name is Caroline Horn. I'm the Associate Director for Orientation and Student Onboarding here at Bentley, and we're so excited to have you all joining us today for our Student Wellbeing live chat.
Yep, in a couple minutes, we'll introduce our campus partners who will share more about their department on campus. But before we get started, I want to share a little bit more about what a Falcon live chat is. So this series is an opportunity for us to connect with our students before they move in on campus in the fall. We are recording this session, so if you're watching this as a recording, you can email us with questions, or if we haven't gotten to it, you can also email us or the department. And you can check out our YouTube for the past ones as well. There is a Q&A that you can utilize. We'll wait to the end of the session to answer your questions. And with that, I'll let our campus partners introduce themselves.
Hi, I'm Julia Matthews. I'm the director of the Bentley Health Center. Very happy to be here and welcoming new Falcons to campus this fall.
Hi, my name is Dr. Peter Forkner. I am the director of the Counseling Center and looking forward to telling you all about what we can offer.
Hello, everybody. My name is Jessica Greer-Trawa. I'm the Director of Community Wellbeing and Health Promotion. We're really grateful to have you with us here today. Next slide. Perfect. There we are. You can skip to the next slide. So we are here to talk about the Centers for Health, Counseling, and Wellbeing. Our teams are committed to the provision of high-quality, inclusive, evidence-based care that supports the identities, beliefs, and experiences of all of our students. We do this through the provision of the direct clinical and psychological services in our counseling and health centers, our prevention-focused initiatives, infrastructure and capacity building, and supporting student resilience. We do this so that we can create a foundation for balance, ethical decision-making, and social accountability within our community. Before we go into the details of our office, we want to just share at the outset that inclusion and quality improvement are really continuous processes in our department. We all have annual racial and social justice development goals. Our teams are trained in trauma-informed care, allyship, and we participate in continuing education for cross-cultural competency and affirmative care. We advocate for services and resources to ensure we're meeting our students' needs. We have web and referral resources that reflect the identities of all of our community members, and we do our best to ensure that our staff members reflect these identities as well. We also have programs and policies and procedures that are reviewed and updated on an annual basis, and our services and the spaces are assessed to ensure that our students are supported, welcomed, seen, valued, and heard. I'm going to turn it over now to Julia so she can tell you a bit about the Health Center.
Thanks a lot, Jessica. So we are located on campus in Rhodes Hall. It's right across from the Student Center where some of you may have done a tour and walked through. So we're very central to campus, which is ideal, especially for our newer students joining us. Next slide. And this is a list of our services and staff. I'd like to share a video with you, and Mia's going to cue that up for us because it really goes through all of this detail in a fun, interactive way, better than I can.
Welcome to the Bentley University Health Center. You can find us just across from the Student Center inside Rhodes Hall, Monday through Friday during regular business hours. Call ahead or walk in to schedule an appointment. Our same number can be used to access our after-hours nurse advice line. Nurse practitioners at the health center can diagnose and treat a variety of injuries and health conditions and connect students with specialty care as needed. All services and records are fully confidential. We can also prescribe medications and have them sent to your dorm room or off-campus residence. We offer easy access to flu, COVID, and other vaccine clinics to keep you healthy and safe. Plus a wide variety of services like contraception options, STI tests, and routine screenings. Be your best, healthiest self with the support of the Bentley Health Center.
Okay, so that really, I think, is a brief summary of what we provide at the health center. As we noted, we're nurse practitioners. We do have a consulting physician that we work with. We also have newly started offering gender affirming care in addition to some of the other things noted. So let's just a couple other notes that are on the side here. Appointments can be made by phone. We are also, students can make appointments by the portal, which we found students find very easy to do. We're open 8:30 to 4, Monday through Friday. We're not open evenings or weekends. However, we have an after-hours nurse advice line. So that is an addition over the last couple of years that really provides students a clinical voice, a support if they have questions, whether it's a cold or a broken ankle or something more concerning, or they're feeling sad. And Peter will talk more about the after-hours services that the counseling service offers as well. And then for any urgent concerns, our university police are available as well to transport students to urgent care or to the emergency room. So as a parent bringing a student to campus, I think that can be very reassuring to know that no matter what time of day or night or weekend, daytime, there is someone that your student can turn to for health advice. Next slide, please. Our services are confidential, and we maintain a strict policy with our medical records. No information is shared with any individual outside of the health center. So if most students coming to campus are 18, if they're 17, we have a consent form for them, and that's also available. But just as a parent calling, you might say, of course, I'm going to call about my student and find out. And we certainly try to manage that in a way that parents feel that they still can know what's happening with their student. But if a student does not want their parent to know about any services that they're getting, it is up to them to share it with their parent. We will not share that information. So a common scenario is we have a student in the health center for a visit. There's some reason we didn't need to send them to the emergency room. We're typically going to say, hey, let's give your mom or dad or your guardian a call to make sure they're aware of what's happening. And usually a student will say, yes, please let them know. The other scenario, so we'll get on the phone, talk to the parent and do that with the student. Sometimes we'll have a parent call, hey, my student has been sick, I haven't heard from them. And we'll say, okay, thank you for your call. I'm going to give your student a call, make sure I have permission to speak with you. So that is just typical, and that might be new for a parent bringing their student to campus for the first time. So just like to highlight that. Just make sure your student emergency contact information is updated so that in an emergency, we would be able to contact the right person for your student. On to the next slide. What I really like to focus on here is for parents and students to know that the health center is confidential. We have competent nurse practitioners and nurse to see them. We are caring, we are conveniently located, and the cost is covered by tuition for a student to come in and have a visit. If there are labs that we're sending out, that would be sent to insurance. Immunizations, we have regular immunization clinics on campus. And again, prescriptions, nurse practitioners can write a prescription that could be sent to a pharmacy, and that would be based on the copay of your health insurance. But what we try to emphasize to students, this is going to be the time in your life that it is most convenient and cost efficient for you to get healthcare. And our job is to really bring students who are coming in as young people to know how to be a healthcare user, to advocate for themselves. Our whole team is dedicated from counseling, well-being, health, to helping students understand what self-care is like. So we just really encourage them to know confidential, that's really important to students, and that the cost for a visit is covered by their tuition. Next slide. And as I mentioned, here are our hours, 8:30 to 4, the after hours nurse advice line. I would encourage any family to look at their insurance card now, give a call and find out what's in network, what's out of network. Is the Waltham Walk-In Newton Wellesley Hospital, that's 10 minutes away. Physician 1 is 10 minutes away. Those are our local walk-in clinics, and then we have emergency rooms. So it would be really good to really understand what is your insurance coverage for local urgent care, for an ER, and for ambulance transport if rarely, but would need that service too. So just important information for student and parent to know coming into campus. Next slide, please. And if you find that you are from out of state or even in state and feel like the answers you're getting from your insurance company feel stressful, that it might be costing you more than you would think, we have an excellent student insurance plan, and I can't emphasize this enough. We do require that all students who are full-time have student health insurance. If you're an international student, you're required to enroll. And that date is August 2nd to enroll or waive. We sit with our insurance provider every year and really think about what do our students value? What do they need? And the cost is, as you see, is $2,400 approximately for the year. It's very reasonable, it's very comparable, and probably, I would say, superior in terms of what we're getting for this cost. There is no deductible. For an off-campus visit to primary care or urgent care, it's $25. Routine preventive care, there's no charge. And for an emergency room visit, it's $100. I'd like to emphasize too, the one really important gain we made this last year from our student insurance plan. For students who do sign up for this plan, there's no cost for ambulance transport. That's a really important question to ask your insurance provider. I've asked it myself, and it's a very variable answer. So to have an insurance plan that provides ambulance transport at no cost is rare and excellent. So just wanted to highlight that for you. Co-pays for pharmacy is there. That's from generic to tier as you go up there. And we do have pharmacy delivery to the campus. So try to make that as convenient as possible, especially for freshmen who are coming in likely without a vehicle. Next slide, please. We also have optional dental and vision insurance and tuition insurance, and there are links in the PowerPoint for you to access that. Next slide. This is the list of required immunizations. The deadline was June 15th. Don't panic, we have more time, but this is important to get this done. These are the required immunizations. As you can see that list, I won't review it, and recommended. You'll see that COVID, which used to be on a required immunizations, has moved to recommended. Strongly recommended. We'll continue to offer vaccine clinics on campus for any dosing that students need, but all of this is really for students who can't get these before they come to this area. Maybe international students sometimes have a challenge in getting some of these done. However, this needs to happen if the immunizations and other health requirements. There's a screening for TB as well as a health history form that we need to have submitted. That's done on the Bentley Health Portal. Next slide, please. Here is our Bentley Health Portal, something that your students want to get familiar with. This is the login, and we try to make it as clear as possible for submitting all of this information. If you have any questions, don't panic. Just send us an email at the health center and we can help you get your student compliant with these. But this is important, and this is how we keep our campus healthy and safe, by having these immunizations completed. And any concerns with those, please just reach out. We can help you finish that up. Next slide. COVID, as you can imagine, in the last couple of years, COVID took up a lot more space in our PowerPoint. I just wanted to not leave it off this year. We are definitely in a much better place than we have been with COVID. And but just wanted again to let folks know who may have some questions or concerns that the vaccine is now strongly recommended. We are no longer doing testing on campus. If someone is symptomatic, they can certainly do a rapid test, and we have them at the health center. In terms of masking, that's a personal choice. We will be asking anyone coming into the health center who has cold symptoms, flu-like symptoms, to put on a mask. Contact tracing no longer happening. We continue to follow the Massachusetts Department of Public Health and the Centers for Disease Control and Prevention, their guidelines on isolation, which can happen in place or return home if needed. So any questions about that, please feel free to reach out. Next slide. So this is just a bit of a summary here. We do have our website, and I encourage you to take a look at that. It is up to date, and we really try to keep all of our resources there. Our teams also have a newsletter, and that can sort of tell you what's happening on campus, any other opportunities, and that will be posted there. And really the final points I want to leave you with, as I mentioned, that we are confidential. Our cost is part of your tuition, so please encourage your student at any time, if they aren't feeling well or just are looking for resources around health, to come to the health center and to go back if they still aren't feeling well. We can provide referrals to specialists, which we will do. Make sure your health requirements are done. Make sure your student logs onto the portal to get that done. And finally, again, our real mission here is to take our students who are coming in, help them become good healthcare users, become self-advocates for good health, and to understand what their self-care is, and really helping them to become independent in this in these ways. Thanks for your time. Over to Peter. And there's our information. Feel free to reach out to me at any time. Happy to chat.
Hello. Really happy to talk to you today about the Counseling Center. As you probably know, mental health has been a really important topic over the past few years, especially in the wake of COVID. And so I want to make sure that I let you all know about all of our services at the Counseling Center to help your student with any sort of mental health issue that they might be going through. We're located on the second floor of the Callahan building, which is right above the police station. It's very easy to access us. We are a staff of 6 psychologists, and we also have 3 practicum students who are also providing care. We have a variety of backgrounds and clinical expertise and are able to help students with whatever they might be going through. All of us have been working in college mental health for a very long time, and so we have a lot of expertise and we're very familiar with sort of what students come with when they come to campus and are prepared to help you. So in terms of our direct services, I always like to highlight that we are able to meet with any student facing any sort of level of mental health related distress. The reason I say it that way is that I want everybody to feel comfortable, regardless of how bad they're feeling, that they know that the Counseling Center is a place they can come and find support. I don't want students to say, oh, my issue is too little, or oh, my issue is too big. As I said earlier, our staff are well prepared to deal with a range of issues, and at the very least, we can do an assessment and help that student understand what it is that they're going through, or maybe provide a diagnosis and help them find resources going forward to get back to sort of their baseline level of performance. In the Counseling Center, we can provide short-term individual and group counseling, which means that students are able to meet with our staff one-on-one, and are also, we have generally during the year a number of different groups that, if appropriate, that students can also attend. For some students, they would prefer to be meeting with somebody off campus, or maybe it's more appropriate for them to be meeting with a specialist or someone who can engage in long-term care, and we're happy to help with students getting connected off campus if that's in the best interest of them. We also have the ability to prescribe medication in those for those students who might benefit from medication, but I do want to emphasize that if a student is coming in already on medication, it's best that they continue with that provider. Our psychiatric providers are only able to see students who've never been on medication and might benefit from starting on a medication. So as I mentioned earlier, we provide short-term care. So for those students who would benefit from medication, we can help them get on a medication and stabilize them, and then refer them off campus for ongoing support in that area if necessary. So often I get the question of who really comes to the counseling center, and as I mentioned earlier, we really see a range of issues here at the counseling center. Certainly for the first year students who are coming in, difficulty adjusting to Bentley is something that we see quite a bit. So students who are having trouble finding their place here, meeting friends, they're feeling homesick, they're having difficulty sort of adjusting to the unstructured life of being a college student. So that's certainly something we help with first years, but we see people with stress and anxiety and depression and relationship and family concerns. Again, the message here should be there is no issue too big or too small that that's not appropriate to meet with one of our staff. As I mentioned earlier, or I guess as I referred to earlier, we have other resources available, such as an anxiety and stress reduction workshop. That's something that we offer on a semesterly basis, and that students are interested in just not necessarily meeting with a clinician, but being able to sort of attend a workshop, that we have that available. We also have it on our website. So if somebody wanted to take it independently, you can go to the Counseling Center website and find that as a resource. We also have something called a Good Vibe series, which actually Jessica will talk to you a little bit more about, I imagine. It's something that our staff has contributed to, but it's a sort of annual event in which we talk about the positive, maximizing sort of the positive psychology benefits of gratitude and stress reduction activities that can be really helpful. If you go to our website, we also have a number of resources, including YouTube. We have a YouTube channel where we've put together a lot of educational videos. We have links to certain meditative practices. We have recommendations for certain apps. So please give that a shot and take a look when you get a chance. As you can see at the, go back just for a second. But though I will reference this later, we have an after hours helpline, although you should be able to access it anytime. So if let's just say one of your students is struggling and it's outside of regular business hours, be that at night or sometime during a weekend or a holiday, they have access to an hour after hours helpline. So they can talk by calling our main number. They can follow the prompts to be connected with our after hours care line, and a provider there will be able to help them with whatever they're going through. Again, it's no issue is too small or too big to use that helpline. Something to emphasize, because these are often what I hear as barriers to accessing our services, is that, first of all, it's going to be too expensive. And the truth is that all of the services are paid for by tuition dollars. So it's not going to cost anything extra or additional to attend the counseling center. Nobody should hesitate to come by thinking that they're going to have to pay extra or that they're going to have to present an insurance card. This is all part of the cost of tuition. I also like to emphasize that everything is completely confidential. We are not able to, because of our licenses in the state of Massachusetts, we're not allowed to disclose any amount of information without the student's written permission. And that includes even to parents or family. And that even includes those moments where to acknowledge that a student actually has been to our center and received services. I can tell you that it happens multiple times a year that I get a call from a parent saying, I just talked to my son and he said he was just at the counseling center and I just want to check in with the provider who was meeting with him. And unfortunately, if that person has not given us permission to share any information, I have to respond in an awkward way. Unfortunately, I can't confirm or deny if that person has been there. And though I encourage you, if your son has been here, to get in contact with us and sign a release. And the reason we do it that way is we want students to feel supremely comfortable coming to the counseling center and knowing that whatever they share with us is just going to be between us and them. Obviously, in the case of emergencies, there's more latitude in terms of breaking confidentiality to make sure that somebody's going to be safe and in that respect. So you can rest assured that if a student is meeting with us, that they're getting excellent care and that we are going to keep them safe. So our regular hours are Monday through Friday, 8:30 to 4:30 p.m. And if a student wants to make an appointment, they can just call the schedule. Just starting actually last semester, and it will be starting again come mid-August to early September. We are also allowing students to schedule online. So if you go to our website, there will be a link right there. Right now, it's deactivated as many of our students are not in state. And so if they, because of our licensing requirements, we're only allowed to see students who are in the state of Massachusetts. So if a student is interested in making an appointment, they can go online. And I think it's interesting to note, I think students really don't like making phone calls, but we found that when we put a link on our website, that it went from like 95% of our appointments were booked online. So anyway, students love this option, so please keep that in mind. I already mentioned the after-hour service, and if there is an emergency, if someone's really concerned about health or safety, then the university police can be contacted at the number right there, 71891-3131. And yes, and there's our contact information. So, and just like Julia, please don't hesitate to email me if you have any questions. Happy to answer them.
Thanks, Peter. So I'm going to tell you a little bit about community well-being and health promotion. Go to the next slide. We are co-located with the Counseling Center on the second floor of the Callahan building. So our team is a little bit different in terms of our scope and practice. So Peter's area and Julia's area have, clinical facing staff members, and our team is really educational and focused, and we often bridge the gap and serve as ambassadors to our clinical team. We are charged with using public health and risk reduction frameworks to provide programs and services for students on all the topics that can get in the way with academic success. So we work collaboratively across campus, and we ensure that policies and people are equipped to best support our students while they're here. Next slide. So as I mentioned a moment ago, we often are focusing on the topics that get in the way of our student success in the classroom. So those areas are usually falling under these buckets. We do a lot of work with students on sleep and setting boundaries with their time. We do work with students on risk reduction around substance use. We do a great deal of work around healthy relationships, communication, consent. We also do skill building around stress reduction and mental well-being. We do education around sexual health, communication skills, and then help-seeking intervention and support. Next slide. So this is just a quote from a student who participated in one of our programs last year. I believe this was the Good Vibes program that Peter mentioned a moment ago. That program involves a lot of self-paced skill building on evidence-informed principles that we know bolster student well-being and promote resilience and reduce stress. In addition to some of those self-paced activities that we manage in a challenge format, we also have a Good Vibes Day annually where students can learn a little bit more and interact with our offices. So this student just had shared that their participation in the program had showed them the importance in taking care of both their mental and physical health and how those two things should be prioritized more often. Next slide. So in addition to some of those kind of program and outreach events, we also do provide direct services to students, either in person or if they prefer, we can connect with them via a secure telehealth platform. This includes health coaching. So, a student who might be struggling with their sleep, we can provide individual support and interventions with them around that, stress management, study skills. We also provide individual support and consultations around alcohol or marijuana use. Sometimes students realize if they're making choices to use these substances that it's getting in the way, and they're looking for strategies to kind of reduce some of the negative impacts that their choices are having on them. And then we provide cessation support support in conjunction with Julia's team around nicotine use. We do have students who do choose to vape and have gotten into patterns where it's become challenging for them, and they're showing readiness to change and cut back. And so our two teams can work together to help support those students. Just like Peter and Julia mentioned with their offices, our team is confidential. We are confidential by policy on campus. And so that, because we're having a lot of conversations with students about sensitive health topics, we want students to feel comfortable in coming to us. That being said, if there is a concern based on a conversation that a student is having with us, we would consult with our clinical teams in the health center or counseling center just for greater support and advice and direction for that student. So I do want to share that we have a vibrant peer education program on campus. We actually have two different peer education groups. The first are the RSVPs, or the Relationship and Sexual Violence Prevention Educators, and they do a lot of peer-to-peer outreach and facilitation on topics around healthy relationships, consent, dating violence, and ways to support peers who might have experienced some kind of harm. They also help co-facilitate our bystander intervention initiatives and just do a lot of great work on campus. And then we have a second peer education team known as the Wellbeing Educators, and they do education and skill building for things like stress management, sleep, self-care, and promoting lower risk substance use options and risk reduction. Next slide. So there are some required pre-arrival courses that will be launching on August 7th. Those include, they're all online, and students will receive information in their emails about it, but the courses cover alcohol and other substance use, again, risk reduction strategies. There's another course that focuses on healthy relationships and interpersonal violence prevention. There's another course on diversity, inclusion, and belonging. And then the fourth course is called Cognito, and it prepares students to have supportive conversations with peers. What we know is when students are struggling on campus, the person they are most likely to turn to, while we would love for them to always come to our offices, might be their roommate or their classmate or a friend that they've met through a student organization. And so Cognito is a way that students can gain practice in just having conversations and approaching peers when they might be concerned, or if a peer shares that they're really stressed out about something. So as I mentioned, we will be launching those in early August. They are due prior to students' arrival on August 28th. We recognize some students might be traveling or there might be other barriers. If a student does have a conflict with that August 28th deadline, we just ask that they reach out to us as soon as possible so that we can make note of that in our tracking system. Next slide. So I think there's a lot of changes that are going to happen. Some of you have students or have older students who have already gone to college. Some of you, this is your first student who is attending college. Some of you who are students listening, this is your first time going away. I just want to share that there's going to be a lot of ups and downs during this adjustment period to the Bentley environment, whether you're living on campus or whether you're commuting to campus. Learning a new culture and a new environment, it can take a little bit of time, and there are going to be moments where you're going to feel really great, and then there are going to be moments where you might question yourself, and that's all okay. It's really important for family members and students listening today or who are viewing this later to also be realistic with your expectations for success, and just know that setbacks can occur. You might be a really successful student in high school, and it could take a little bit of time to figure out how to be a successful student in college. The way course content is taught is different. The way courses are assessed is different. And also just there's so many different things to get involved in on campus and other ways that students are spending their time that, finding that balance could take a little bit of time. So please be realistic and practice self-compassion if things don't go the way that you usually expect them to. Please don't compare students' experiences to what you see on TV or social media. I think oftentimes the conversation talks about how college is one of the best experiences of your life. And that might very well be the case, but that's not necessarily the case every single day for every student on campus. And so please just be cautious of always comparing your experiences to what people are posting online. We know from the research on social media that people will often curate their best moments and they're not necessarily showcasing the less great moments. And so you are constantly exposed to the highlight reel and not necessarily what is realistically happening. Adopt a growth mindset. Please, please, please try to disconnect from devices at times. We are all connected to these so much, but these create a barrier for how you can build connections with other students on campus or other activities on campus. We always try to encourage students to get outside as often as possible. If you've never resided in New England before, it can be difficult when the weather changes in the late fall and winter. But it's really important to get outside of the classroom spaces and outside of any residence hall spaces. And in terms of other things that family members could do, just encouraging self-advocacy. Julia talked about how one of the roles of the health center is really developing students' autonomy in their healthcare and their literacy around healthcare. Please encourage your students to take advantage and contact us on their own or other services on their own. If you're intervening on their behalf, it is not necessarily building their confidence and competence in navigating this world as young adults. Normalizing failure. And then the last kind of tip around adjustment and well-being is really encouraging involvement. We often hear from family members that they want their students to focus primarily on their studies in their first year. And ultimately, that is really important, but it can be limiting for students and sometimes socially isolated for students. The research actually shows that involvement predicts better adjustment for students on a university campus. And there's many ways that students can become engaged with different co-curricular experiences. That could be as simple as joining a student organization, which we have over 100 of, or a club team or a competitive sports team or an intramural. There's also a lot of opportunity for student employment and leadership roles on campus. We have academic, spiritual, social programs and events. So even if a student doesn't want to commit to joining an organization, they can still attend these events and meet different people at events that are happening on campus. And then we also have a program that's offered called Bentley Plus that helps students kind of identify some core competencies to work on during their Bentley career. And it gets them connected with a variety of programs and resources on campus that can help students in developing those competencies. And so that's another kind of pathway that's available to them. Next slide. So I would be remiss for the caregivers on the phone to also not share kind of our best advice for things to talk about with students ahead of their arrival here. The first is having a conversation around healthy substance use and patterns. This includes both alcohol and marijuana, which is legal recreationally in our state for persons over 21. Talking about the amount, the frequency, pacing, how to consume healthier. While we do provide some of that education for students, the research shows that when parents set expectations around alcohol, for example, their students tend to drink less if they choose to drink at all, associate with peers who drink less, and also perform better academically. Not every student in our campus does choose to use substances, and regardless if your student does choose to use or not, having the talk is still important. Our students also struggle with setting personal boundaries with their time, with their space. A lot of it is fear of missing out or wanting to develop connections with people and concern about, if I say no, will I receive some social rejection? It's really important to prepare them for how to communicate effectively with boundaries and reading verbal and nonverbal cues. When we say consent, I know oftentimes we talk about it in connection with dating relationships or sexual relationships, but the truth is consent is going to be necessary for, if a student is choosing to live on campus, navigating whether it's okay for a peer to sit on their bed when they're visiting their roommate, or if they can borrow clothes from a friend down the hall, or whether they can share an outline with a student because they want to see their notes. These are all situations that require consent and communication and boundaries. Talking to students about their sexual health and safer sex. Julia didn't necessarily go into tremendous detail about this, but we do have STI clinics for students, and our nurse practitioners regularly talk with students about options for contraceptive care, as well as other, safer sex initiatives. We have gender affirming care. We have supplies and access to supplies in the health center, and our office offers individual safer sex kits that students can sign up for, and we get the supplies directly to their hands. Talk to your students about sleep, the needs for quality sleep, consistent schedule, and the inhibitors. Again, going back to that notion of sometimes students will stay up late because they're worried about missing out on some social interactions, or they will sacrifice sleep for some of their academics. And we find that a lot of students struggle with sleep, and it's one of the easiest things to control that can be preventative for mental well-being and physical health. And then lastly, having plans for managing student stress. Ask your student, what does stress look like or feel like for them? What are the ways that help them feel better? And getting them to start thinking about the tools and resources available on campus that can assist them with managing their stress. So any one of our offices can assist with that. And we also have, other entities within the environment that can assist with some of these stress management pieces. Next slide. Stay in the know. So our department, as the ambassador for all three teams, runs the Bentley Health Instagram account. Please feel free to give us a follow. That's one way you can learn about the various initiatives, resources, and a lot of topical content that we cover. We have a wealth of information online as well on our resources website. So you can go and take a look. You can access it through bentley.edu/wellbeing. And then there's a button for health resources there. Next slide. And then just wrapping up with some reminders, as Julia mentioned in her section, health requirements are due now. Please continue to complete them. The health insurance plan, you have to enroll or waive by August 2nd. The required online courses that I mentioned a few moments ago will launch on August 7th and are due on August 28th. Please reach out to any one of us or our partners on the care team with any student concerns you have. Even if it doesn't relate to our area, we would be happy to facilitate a connection for you with the resources to best support your student. And as I mentioned, give us a follow on Instagram so you can stay in the know of what's happening in our area. And here's our contact information. Again, we're located along with the counseling center above University Police. There's my email and our office email. And that is all we have today, but we would be glad to answer any questions that you have. I know Julia has fielded a couple already as we've been going through this session, but please feel free to let us know if there's other questions you have related to the services or ways we can support student well-being while students are here. Julia, do you want to review, in case anybody wasn't watching the chat, what the two questions were and just summarize them?
Sure. Thanks for that nice wrap up as well. I just see a new one came in. Our health documents required now for spring start. No, there are different deadlines. You're welcome to upload them. I'm not sure your student would have access yet, but those deadlines are different and those will be on the health portal as well. So I think for January, we're looking at getting most documentation by the end of November, early December. I think it's maybe December 1st. But thanks for that question. The other question was, can a student file their healthcare proxy with the healthcare center? Yes, they can. They can provide if there's a healthcare proxy, if your student has perhaps history or current medical condition that you think would be useful for the health center to be aware of, they're welcome to get that information to us and we can put it in their medical record. We've also are very happy to talk to any student family prior to your student coming. If you have, for example, a student with diabetes wants to make sure they know where they're storing their medication, or they're not from local and they would like to set up care with a local endocrinologist, which we recommend. So it could be a chronic condition, could be that your student has allergies. Maybe they have a severe peanut allergy or some other allergen. We have a wonderful nutritionist as part of our food and dining services that can give your student a tour of how our dining is set up to keep your students safe. So those are just a couple ideas. If there is health information that you think would be useful to share, we're happy to talk with you. We're happy to add information to the medical record. We're happy to help you find a local specialist before your student is here. The other question was around health insurance. For someone who's out of state, if they sign up for a student health insurance plan, what happens when they go home to their own state? Would they need their local health insurance? I'm referring folks to our university health plan partner. I think that's a great question. I believe that a student is able to have a primary and a secondary insurance that I think would function to make sure that you have sufficient coverage, whether you're in state or out of state at the time of visit. But our partners at University Health Plans that manages our Blue Cross Blue Shield student health insurance are responsive, excellent, super knowledgeable, and are available anytime. So I gave the contact information there for them. We also, just to note, we've brought back webinars that we do with our health insurance provider. We had one in earlier at the end of the spring semester for our graduating seniors to kind of help them understand, how am I going to start my new job, and look at what type of health insurance coverage is available. How would I compare that plan? What should I sign up for? How do I do that? So we had that in the spring. We'll have another one in the fall, particularly geared toward students who are entering. How do I use my insurance? How do I access care? What's a copay? What's a deductible? Kind of all that information. And also with some particular focus on our international students who may not be familiar with our US healthcare system, which, as everyone in the world knows, is very complicated. So we're trying to make sure those resources are available for all students, but particularly in the fall for incoming and in the spring for outgoing. Any other questions? We're available. Thanks for the nice summary, Jess.
So it looks like also we've gotten a couple of other questions in this chat. So one question is just, are all these services reviewed, presented during orientation, or covered in August videos? So Carolyn, I'm going to take a stab at this, but if you could also chime in, since you are most familiar with the orientation program. So the answer is yes, and in several different ways. And so students were first introduced to our services during their online orientation, which I believe was live last month. And then at orientation itself, there's a few different pathways in which they'll connect with us. So Peter and I are part of a panel that's presenting to all of the students on Saturday, where we will cover these resources for students. And I know Julia's team is participating in kind of like this resource fair where students are going to be coming into her center to be learning about the services offered there. But in addition, there's kind of microdosing that happens throughout the time that students are participating in the program. So through small group discussions or other sessions that relate to these topics, the orientation leaders and the content that's presented is going to be referring back to these resources. I'm sure I'm missing something, Caroline. Is there anything you would add as well?
No, that was a great summary, but we do have, so one of the programs that Jessica was mentioning is called our community meetups. So it will be a chance for students to learn all about the different lounge spaces within the student center, some of our different departments that work directly with students, as well as some of our offices. So since the health center is right across from the student center, we are including the health center in that resource fair style session this year. And then we also do campus tours with our students within their orientation small groups, so they're able to learn more about campus and hear it from a student perspective as well, which is helpful when we can share all the information as a professional, but having that student voice is also really important too, and how they utilize the services on campus. And then the second question is about getting involved in campus activities, and we will introduce students to all of those different activities within orientation, but I'm also going to throw it over to Mia to talk a little bit about what that activities fair looks like and how students can begin to get involved once they're on campus.
Yeah, definitely. So during the activities fair, all of our clubs, organizations are spread out across our green space and our student center. So you can walk around to the clubs that are most interesting to you. You can also find them on campus groups. All of our clubs and organizations are on there, so you can see them there. You can also look them up on Instagram. A lot of our orgs have Instagram, so if you have more specific questions and you're too nervous to go up to the table, you can always like message them over Instagram. And a lot of clubs I joined was through word of mouth, like my roommate would join, so I was like, oh, like I'll go with you. But so that's how I mostly got involved in a lot of my orgs, is through the activities fair and through like just word of mouth.
I'm just going to quickly go back to the comments about will we be presenting in front of the students? And I think it's important to recognize that we found that many of the students we talk to in orientation, we can do it in multiple different ways. They are so psyched to be on campus. They're so excited to start school. The last thing they're thinking about are, oh, what happens when I get sick, or what happens when I'm, feeling homesick. They're generally coming in super optimistic. And so I have to say, even though I think I'm a pretty good presenter in person, sometimes they're not paying attention. So it's a good idea for you all to sort of make note of these services. And just in case you hear a wisp from them that, oh, things aren't going 100%, you will have all the resources at your fingertips and can send it along to them.
And to piggyback off of that, my department, along with our housing department and our student conduct team, puts together this resource that we, for residential students, put on the back of every single residential room door. And it basically is like a supportive resources for students, and it has descriptions along with QR codes to our websites, and then direct phone numbers for a variety of these care and service-oriented resources for well-being topics. And then Caroline, for our students who are commuters who are attending orientation, we do put a copy of that document in the orientation app. So we try our best, as Peter mentioned, our students aren't thinking about needing these services until they do, but also know that they can very easily find the information on how to access it. Again, for residential students, it's going to be on the back of their door. They can just scan the QR code and it'll get them connected to us. And then our commuter students, we try to make that resource available for them too.
All right, and the orientation app has been mentioned a few times, and that will go live in about mid-August. So we will send out more information to all of our new students on how to access that app. We'll also be doing some different posts on our Instagram channel to really talk about how to best utilize that app throughout orientation and throughout their first few months on campus. And we also have an orientation live chat next week. So it will be on our orientation program. We'll talk a little bit about the international student orientation and the Mosaic experience. So orientation, pre-orientation, and more. So definitely look out for more information on that when we'll really dive into what the end of August will look like for your students. But thank you to our panelists for taking the time to present today. And thank you for all of you participating in this. And if you have any questions, feel free to reach out and we'll be sure to get those answers for you. Have a great day.
Thank you.